Thank you all. And now it's the time to start the international session. Today is the 1912th day. Before beginning the session, let's have a silent prayer. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1912th day of uninterrupted daily webinar of IFPH. Today, our guest speaker is Dr. Prakash Rao, MD, PhD, and he do have a PG in rehabilitation. He don't have much introduction because he is very familiar for us. He is a former research officer, CCRH, Government of India. He do have more than 30 years of experience at CCRH. Dr. Prakash Rao undertook various projects with UNICEF and AIDS Control Society. And today our session is the fourth part of the series, Infertility, Homeopathy and Research. And today we are going to discuss about PCOD. Let me welcome Dr. Prakash Rao for this session, and I welcome you all for the session. Doctor, please.
Sir, good evening to everyone, and namaskar. Thank you very much. Can you see my slides, sir? All you people are very well known to me. So I need any formal welcoming or wishing you. So you are personally known, and from last 3-4 years I am speaking for you. And my topic today is the infertility. So we are going to the fourth part of the infertility. Here I would like to remind everything about the infertility, what we spoke from the beginning, just to make you refresh. Can you see my slides, sir?
Yes, sir. Yes, sir. It's visible. We can make it full screen if you need.
Yes, sir. That I am trying. Just a minute. Yes. One minute, sir. 1 minute, sir. I need little time. Sir, can you see now full screen, sir?
We can see that. We can enlarge it, but it's not a must. We can start, sir.
Okay.
It's visible.
Yes, sir.
Okay.
Now the infertility. Let me decrease this screen, sir. Yes. Yeah. Now, what is infertility is defined as a failure to conceive within 1 or more years of unprotected coitus. See, what we call is after marriage in India or after living together for having children in other countries, where if they have sexual intercourse for more than 1 year and if they fail to conceive, that will be known as the infertility. The terms are too many things: primary infertility and secondary infertility. The term primary infertility is applied to the couple who has never achieved a pregnancy. The secondary infertility implies to at least one previous conception. That means either abortion or conceived or carried pregnancy for about 3 months or 6 months or what you call around 6 weeks, 8 weeks or 9 weeks. Then failure to conceive, then subsequently followed by abortion and unprotected regular coitus. These all are known as secondary infertility. Then factors that are responsible for fertility are healthy spermatozoa. Now we are talking the infertility from PCOS. We are coming to infertility. We have to discuss infertility means it is the both are responsible, the both partners, male and female. So male and female, both the partners are responsible. Therefore, we have to talk about both female infertility and male infertility, so that if an infertility case comes in our clinics, we need not feel any unhappiness or how to go see where is the defect to find out, only to make you to remind all these things I am taking up this. Then the factor responsible for fertility, healthy spermatozoa should be deposited high in the vagina. The spermatozoa remain healthy and penetrate into the uterine cavity and hence into the uterine tubes. The ovum finds its way into the uterine tube, where it can be fertilized by spermatozoa. The fertilized ovum migrates into the uterus and the endometrium must be in a state suitable to the mediation of the subsequent development. If the endometrium is hurt, if the endometrium is inflamed, if the endometrium is not fully developed before the migration of the zygota to the cavity of the uterus, it won't take the infertility, the fertility won't take place. Even if the fertility took place, if the zygote is transformed, it will leads into abortion. So the safe endometrium, the healthy endometrium, the walls of the uterus are most important. So in particular, the endometrium is most important. Then fecundability, what is 20 to 25% of the couples will conceive. See, usually after marriage, 20 to 25% of the couples will conceive, and they will have the female will have regular cycles, and 50% should conceive after 3 to 4 months. Usually, what happens immediately after marriage, usually within a month, within 2 months, 20 to 25% of the couples will go for conception, and 50% will be after 3 months to 4 months of regular intercourse for a continuously. Then 95 will be conceived after the year. Usually this will be the problem. See, usually nowadays they are also following the family planning methods for the sake that there is no feasibility, there is entertainment, there is early marriage, then they want to enjoy the married life. So they will delay, but otherwise 20 to 25 within a month, 50% after 3 to 4 months, and 95% are after 1 year. Even after 1 year, if they never conceive, that means that will be deemed as infertility and they come for treatment. Usually, when they go to allopathic doctors, number one is the attitude of the allopathic doctors. Number two, unnecessary treatments. Number two, unethical practices. Number four, the side effects of the medicines. Number five, too costly. So these all will make a patient to come to homeopathic practice because there are two things speciality in homeopathy. One is the homeopathic doctors is well versed with all the subjects of the modern medicine because only therapeutics will change. Rest of all the curriculum is as equal to allopathic doctor. So they will understand what is the case, number one. And number two, what are the investigations one must ask to undergo. That is number two. Number three, they also will know which medicine has to be applied and they will understand what hormone is needed, when to apply, when to discard, when to stop it, when allopathic treatment non-hormonal has to be stopped. These all will be understood by a homeopathic doctor. So he will be in a position to make the infertile couples to conceive without any side effects, bad effects, or contraindications. Usually, to a homeopathic doctor, when we have taken a survey, nobody comes after 2 years or 3 years. Usually, after the marriage of 5 years, they will go to everywhere. When there is no facility to in vitro fertilization nowadays, previously it was not present, but nowadays even they will try in vitro fertilization. They waste their money because the percentage of the success of in vitro fertilization and homeopathic treatment are both are same. Here, there will be the cost of the burden of the cost or the financial burden will be more. Here in homeopathy, there won't be any financial burden. But patients nowadays, to understand all these things, they will undergo 1 or 2 sittings of in vitro fertilization. When the in vitro fertilization fails, then only they will come to homeopathic treatment. Number two, infertility factor, origin of the problems. 30% of the female are problematic and 30% are male. 30% both. So 90% is over. And 10% of unexplained problems. In the sense, we have to go thorough for investigations in these 10% of the cases. Whether genetically there are some mistakes or anything, if the chromosomal defect is there, there will be family history of not conceiving. In fact, many causes are there. In our next slides, we will see that. So, 30% of the female, everybody thinks that when there is infertility, the female will be responsible. But when the statistics have been studied, it is found that it is not only female, it is also male that is equally responsible, and it is female infertility is as equal as to male infertility, and both the partners together, there will be 30% of both the partners. So 90 out of 100 cases, 90 cases have been covered. with both the partners 15% each, with one partner 30%, with another partner 13%, and another 10% of the factors are to be probed. What is the reason why it is not taking place? What is the defect? What is the science behind that? We have to understand. And it is not too easy to treat the case of infertility. Does infertility comes as a disease to not having a children? No. But at the same time, the conception or the motherhood for female and fatherhood for male are the birthright properties socially, psychologically, culturally. So it is their duty to have a child. So though it never comes as a disease, if it is genetically seen, it is also a abnormality that can be applied and that can be addressed through medication. Next, female infertility, etiology. These all you know very well, but just where the homeopathic medicine acts, what is the course of the mechanism of the homeopathic medicine when it is given, like Sinisifuga, Colosin, Calophyllum, Murex, Palacitilla, Natramur, Laxis, Lycopodium, what not every medicine. We will talk what is the percent of the medicine in our next part, but let's understand this. I request everybody not to forget this so that the mechanism of the medicine when it is being discussed. So we cannot understand the pathology without any mechanism of action of medicine. The medicine won't be successful. There won't be any evidence. So as a researcher, we worked on the evidence-based medicine. I will show in my next fifth part. So cervical mucosa. What are female infertility etiologies, sir? Cervical mucosa 20%. Endometrial, uterine causes 10%. Pelvic, peritoneal causes, the pelvic causes, either defective pelvis, the bones are not malformed. Tubal, there will be the tubal percentage is very more, 30 to 50%. Usually tubal block, PCOS, PCODs, pelvic, cervical, all disorders and symptoms. Then ovarian causes, immature ovaries, the follicles are not up to the mark, the follicular stimulated, the ovaries are not fully developed. These are some of the causes. So 20% goes to cervical reasons, 10% goes to endometrial reason, 5 to 10% goes to pelvic reasons, and tubal 30 to 50%. Usually there will be tubal block. We will see that it may be because of infections, that may be because of previous disease conditions, and ovarian causes. Nowadays, the obesity is very common. The diet has changed, the lifestyle has changed, the economy has changed. So everything is having severe impact over the physical part of the body, and there the ovarian causes are 25% in female infertility. Now, faults in the female ovarian factors because they are around 25%. So we have to study the ovarian factors. We have to remember and rethink. See, the ovarian dysfunctions are dysvolutory encompass ano-ovulation or oligo-ovulation. This is disturbed hypothalamo-pituitary ovarian axis, either primary or secondary from thyroid or adrenal dysfunction. This has to be investigated. When patient comes to us, our job will become very easy because we will go to no kind corner of every qualified, highest qualified allopathic doctors. Then they will come with their reports. So we need not order them anything. All we have to see that how the reports will become negative, because negative in the sense they will have all these pituitary dysfunction, thyroid or adrenal dysfunction, or secondary to primary axis of the thyroid, or disturbed hypothalamo pituitary. But these all will have mental symptoms, except even thyroid will have depression. But the primary or secondary from thyroid, adrenal dysfunction will be there. So we will find the other symptoms like obesity, thyroid, there will be depression, mood swings and everything. And disturbed hypothalamo pituitary is very difficult to understand, but they will have a migraine and they will, the entire symptoms will be, they come primary for that hypothalamus pituitary ovarian functions, not for infertility, because that has to be addressed. So this history will tell. Now, in homeopathy, the case record is wonderful mechanism where we can understand every cause of the disease. In those days, the developed case record mechanism that is nowadays it is helping us to go to CRISPR medicine, personalized medicine, and genetic medicine, individualized medicine, All our terms are blackmailed and being used, and our theory is being used. The only thing is the evidence is present. In those days, whatever the science that was developed, it was present, and basing upon that science, a beautiful case record system has been developed by Dr. Hahnemann under the name of totality and individualistic symptoms of medicine, and now that is helping us to compete with modern technology in the health science. So, corpus luteum insufficiency. What is corpus luteum insufficiency? Is shortened or less than 10 days of insufficient secretion, or progesterone less secretory charges, hidden implantations. See, there will be hidden implantations not to have conception. Even nowadays, everybody is using, because the birth control pills are causing enormous side effects. At the same fashion, the lifestyle disorders are coming. The education and modernity under the name of enjoyment has changed the definition. So there will be implantations not to have pregnancy before marriage. So these all are some ethical problems. We need not discuss about that. That will be known on X-ray or dye passing or ultrasound. So that will be diagnosed. And luteinized unruptured follicle. Usually this is the main cause. The follicle never ruptures and the ovary never comes into the fallopian tubes. From there it never travels to the tubes. From there tube to it never travels to the uterus. So menstrual cycles will be irregular. There will be less bleeding, and there will be luteinized unruptured follicle will be present. The unruptured follicle will produce severe dysmenorrhea, and at the same time, it never takes ovulation. So this has to be studied when case comes to you, and they will be tested everything the menstrual period every day after giving the progesterone hormone. So patient comes again with reports to us to be treated by us. Then tubal factors. What are the tubal factors? I told 20 to 25% of the tubal factor, 30%. See, this is impaired tubal function. Tubopathy, like homeopathy, it will be known as tubopathy. That includes defective ovum pickup, impaired tubal motility, loss of cilia, and partial or complete obstruction to the tubal lumen. See, a homeopathic doctor has to study even the gynecology to understand this. Though the gynecology is fully explained, there is a separate chapter. And nowadays, the teachers are from modern systems of medicine. The obstetrics and gynecologist, who is MD from allopathic system of medicine, teaches homeopathy. But when they comes to infertility, this is a neglected topic. It will be covered in the therapeutics, not in the gynecology. See, they never ask gynecological subject one homeopathic question: what is the cause of the infertility and how you deal with infertility will not be asked in gynecology question papers, but it will come to in materia medica, or it will come into the repertory, and in repertory they will ask you to see, and in materia medica they will ask what are the medicines for infertility. So these are some of the things where the curriculum must be changed so that future doctors who are coming out of the college, they will learn very well with the infertility. And is it a neglected subject when we were taught gynecology? They will go for easy delivery, easy menstruation, easy dysmenorrhea, but they will not be taught fully or covered or the hormonal or endocrinal imbalances that will take place in infertility. And these are some of the lacunas in our teaching. So, uterine factors. The endometrium must be sufficiently receptive enough for effective nidation in the sense and growth of the fertilized ovum. What happens? The endometrium must be sufficient. The endometrium growth, it should have like a silk mucous membrane, a silk cloth. It should have enough foldings and receptive enough, and it should be totally sterile. And growth of the fertilized ovum must take place in the endometrium of the uterine. So in the pit of the uterus, so endometrium should have enough foldings and without any infection, then only the fertility takes place. The possible factors that hinder nidation are uterine hypoplasia, uterine endometritis, uterine synergia or congenital malformation of uterus. What happens? The uterine hypoplasia, that is known as childish uterus, or the uterus will be very small, and the pediatric uterus in the sense hypoplasia, underdevelopment of the uterus, and the vagina will develop normally. The inclination for romantic feelings and the hormone will be excellent, and but the hypoplasia will be present. When the hypoplasia, even the tubes will be normal. The hormone level will be normal, but the congenital malformation of uterus will takes place. This will be known by through ultrasound, and usually nobody observes. But when the uterus is small, there will be irregular periods. That will be periods will be delayed once in 3 months or once in 6 months. The blood will be collected in the small uterus, and that will become very black. The black blood will be secreted from the uterus, where you will find the laxis or crotalis hardis symptoms, and there will be injury. At that time only, when a doctor examines or when the ultrasound examination has been done, the hypoplasia, that is stunted growth of the uterus, will be seen. This happens in many congenital deformities, like one will have 6 fingers or one will have cleft palate. So in out of 100 cases, the 2 cases will have hypoplasia of the uterus. For hypoplasia also, if it is earlier diagnosed, and these hypoplasia patients, they will have menarche, not at the age of 13 or 14 or from 12 to 15. They will attain menarche at the age of 20, 19 years or 18 years. So the endometritis, the inflammation of the endometrium, this is tubercular or in particular or some infection, usually even from other infections like leucorrhea, staphylococcus bacteria also causes. In tuberculosis particularly, the uterine endometritis, very common tubercular endometritis. Nowadays the cases in pediatrics tuberculosis, that is in young tuberculosis, reduced, but the tuberculosis has increased. The allopathic treatment has successfully controlled tuberculosis. They have primary and secondary tuberculosis treatment. Despite of all these things, the common cold, the post-tubercular infection, the secondary tuberculosis are bound to have homeopathic treatment. Otherwise, the immunomodulatory functions won't be there. So nowadays, there is no discrimination among the allopathic doctors as far as the secondary tuberculosis is concerned. And if the endometritis is nowadays becoming rare, and it is only coming where the hygiene is not up to the mark or it is being infected, but otherwise it is very rare. And tuberculosis also, the secondary tuberculosis of the lungs also, patients will come to homeopathic doctor. That is a separate chapter, we will talk later. Now we will limit ourselves to the endometrium. Then congenital malformation of the uterus, I told hypoplasia. And in congenital malformation, what happens? The elasticity of the uterus will come down. There won't be any 3 layers: endometrium, myometrium, mesoderm, endometrium. All 3 layers won't be present in the uterus. And either uterus elasticity will come down during the periods or it will become stiff. Though the uterine functions are normal, though the hormonal functions are normal, though the size of the uterus is normal, the elasticity of the uterus will come down, and by that there won't be any infertility. The uterus is like a sanctum sanctorum. It is like a temple. If it is clean, clear, aseptic, normal in size, if it is in a position to give birth to a fetus, or if it is in a position to accept the fetus without any infection, then only the uterus will grow. It is not like that. If we put something or if there is some infection, the uterus never accepts the fertility, and there will be misconception. And cervical factors. What are the cervical factors? We have studied now tubal factor, the ovarian factors, then the uterine factors. Now we are coming to the from inside to outside. The cervical reason for anatomy factor is anatomic defects in preventing sperm ascending may be due to congenital elongation of the cervix. See, the congenital elongation means cervix will be 1 inch more in size, or ½ inch more in size, or 2 to 3 centimeters in more. So by the time the spermatozoa reaches the neck of the uterus or neck of the cervix, they will die, because the 1 centimeter length or 2 centimeters length, they will not sustain their life for 48 hours. So it is again a defect that has to be rectified. The second degree uterine prolapse. Usually what happens, uterine prolapse will take place in young girls because of severe obesity, because of some of the other problems from rectum and some of the problems from the piles infection, other proctitis problems. So the uterine prolapse has to be rectified. Usually this takes place in obese patients. Acute retroverted uterus. What happens sometimes, usually in old patients, in old aged women, the anteverted uterus will be there, takes place. But in young people, what happens if the uterus is bulky or something happens, it will takes retroverted uterus. So retroverted uterus has to stand still. In the sense, it should be straight. So that has to be corrected. And these conditions prevent the external os. There will be external os, internal os in the cervix. So the external os to the seminal pooling or semical sucking will not be present. And pinhole os maybe at times will be implicated. See, there will be internal os that will be pinhole. The external os problems can be understood by the partners. They will go to immediately doctors. But the internal os, when it is constricted, that cannot be understood. And there will be sometimes polyps in the cervical canal, like Bartholin cyst, a polyp, which will obstruct the spermatozoa. If the spermatozoa stands there, it will be killed, so there won't be any fertility. These conditions must be tested, these conditions must be asked, or these conditions must be investigated, and then only we can proceed for the medicated medical treatment. Then psychological, there are physiological problems. What are physiological? The fault lies in composition of the cervical mucus. See what happens, the pH of the cervical mucus has to be tested. So much that the spermatozoa fall into penetrate in the mucus, they will die. If it is more acidic, if it is more alkaline, the spermatozoa will die, and that has to be addressed. So the cervical, this is the physiology of the body that will have entirely different physiological functions, and they have to be understood. So the pH of the cervical mucus has to be tested. The mucus may be scanty. Sometimes what happens, there will be secretion of the scanty mucus because of the romantic feeling may not come. They may not like. See, there will be psychological disturbance. There will be amputations and deep cauterization. Somebody will have anorectal fissures. So there the infection will penetrate. So there will be the scanty flowing. There will be some defects that must be tested. The abnormal constituents include excessive viscosity, purulent discharge, white discharge, internal as infection, chronic cervicitis. This is common with every young girl where they will be going on complaining leukorrhea with smell, leukorrhea color. They are the homeopathic repertory, and Materia Medica has addressed so many medicines on leukorrhea. If the leukorrhea is with, if it is in color green or yellow, green means it may be a viral infection. Yellow means definitely it will be a bacterial infection. And there are various homeopathic medicines to address all these problems. So the cervicitis, whether it is chronic cervicitis or acute cervicitis, these cervicitis can be addressed. This will always accompany with usually the urinary tract infection in young girls because of using continuously the pads and usually being protected. See, ladies won't have so much of freedom to urinate. They have to stop their urination and they have to control the urination for hours together. The colleges, the education institutes, the higher institutes, they don't have very good refreshing rooms that are basically to be utilized, particularly bus stands in India are not developed so much. So this definitely, and they are the highly infected places. So naturally a woman will have to be infected from the walls of the bathrooms also. So this will cause the cervicitis and presence of anti-sperm or sperm immobilizing antibodies. Usually this will be tested. This is also not rare, but there will be antibodies that will be developed from human immunosuppressants and human immune mechanism. This must be definitely addressed. The immunological factors of the infertility must be addressed and they have to be understood. Usually, this is the reason where the size of the uterus, the cervix, fallopian tubes, as well as endometrium, everything is fine. But there will be immunological factors of the infertility where the antibodies to the hormones will be produced, particularly to the progesterone hormone. There will be an antibody, and that antibody never makes the pregnancy to takes place. Why that antibody comes? See, the nature has produced a physiological reason. Even I will compare this with to make you to understand. There will be bald headedness in a young male persons. There will be a total bald, and why that young person will develop bald headedness? That is the antibody secreted against the testosterone. If the testosterone, dopamine, and serotonin is secreted more in quantity and quality, their mind will change and they will become criminals in the society. So the nature has made them not to produce excess quantity of the testosterone. The antibodies to the testosterone will be developed. Here also, in immunomodulatory factors, the antibody in female to stop the excess progesterone development or follicular stimulating hormone, the antibodies will develop, and those antibodies will kill any foreign particle that entered into the cervical os. So there the infertility will take place. This you have to keep in mind. See, everything will is normal. And many people will tell that I gave Sinisviga and it was successful. It is Sinisviga that acted on immunomodulation and anti-infectiveness, and it has made the uterus, endometrium, myometrium, and os totally clean, and the immunomodulation took place. That's why there will be infertility. Even this immunomodulation factor, the most expert gynecologists will miss. They never consider this because see, the diagnosis part of the disease is not only the birthright of allopathic doctors. Even homeopathic doctor can diagnose. Sometimes better diagnosis is possible from homeopathic doctor than the allopathic doctor or a super specialist, because every homeopathic doctor will see the cases that failed from allopathic school of or the conventional school of medicine. So he learns more. He will be a neurologist, he will be an endocrinologist, he will be an immunologist, he will be an orthopedician, he will be a dermatologist. So it is multi-dimensional. He will be a gynecologist, he will be a specialist in infertility, everything. So homeopathic doctor learns more in his practice than the allopathic doctors. He is a super specialist. He is a super specialist. He is a specialist for super specialist. This is what conventional medicine. So that's why they use homeopathic speciality. And vaginal factors. This is atresia vagina. That is partial or incomplete development of the vagina, the vaginal walls and the vaginal muscles. Transverse vaginal septum. The septum that will go inside, and it kills the once the septum is not coming out, and if it is going to too much of length, if the septum is obstructing the spermatozoa inside, so the spermatozoa will be instantly killed, and fertility won't take place. And septate vagina, in the sense there will be a vaginal mucosa, the vagina will be a round tube. In that round tube, there will be septum, a septum of 1 centimeter. In the sense inside or outside on the middle side, it is very difficult to diagnose until unless the gynecological examination is done or gynecological radioactivity ultrasound is taken. So that septum will make the spermatozoa not to pass from the tube and causing that is dyspareunia are included in the congenital group. So congenitally that will septum will be there. Usually that will be surgically removed, and then after 2-3 months the infection will totally heal and fertility takes place. So these are some of the anatomical factors that will make female not to conceive. Then others, age. Fertility decreases after the age of 30 in women. But however, there are cases the fertility took place even after 40. In recent case, one of the women of age 52 years has conceived after in vitro fertilization. It is not the uterus. See, we can make the uterus normal with various hormones. At the same time, with various homeopathic medicines too. But the percentage of normal fertility will come down after 30. The studies have shown the 50% of the are definitely that is known as elderly primate. So it is very difficult. So that's why it is better to have marriage at the age of 24, 25 to have good parentalhood. Even if severely low sperm count present in the female prior to the age of 30 may compensate her infertility. Maximum fertility is around 25. See, I told that 25 years is the best age to have maximum fertility rate in women. So it is better to get married at an earlier age for women. And even the spermatozoa count also will come down in males after the age of 40. So one has to be physiologically very strong. One has to keep in mind and one has to educate the society. The doctors, particularly homeopathic doctors, are highly attached to the society and they have to create awareness among the people so that the marriage will take place at an earlier time. Then we will come to male infertility reasons. The male infertility reasons are faults in the male defective spermatogenesis that everybody knows, obstruction to the efferent duct system. See where the duct system is clogged. When the ducts are closed, the spermatozoa, either seminal vesicles or whatever it may be, failure to deposit the sperm high into the vagina. What happens? The vaginal mucosa and less secretion, fault in the male duct, the spermatogenesis will take place. Then when we test the sperm, there will be 100%, all 100%, 99 millions of spermatozoa will be present. But when it entered in the duct, the high level vagina failure to deposit the sperm in the high vagina, errors in the seminal fluid. What happens in the seminal fluid? There also again the pH values. If the seminal vesicles are functioning more, they will kill spermatozoa. There are various physiological faults. This is the male infertility. As told in the beginning, the reason for infertility are 30% male, 30% females, and both together type 30%. So, common causes of male infertility: defective spermatogenesis, that is undescended testis. What happens? The testis usually one of the right side testis will in scrotum, it will descend, and undescended testis at the age of 5 or 6. See, usually patients never come and they think that at the age of puberty definitely it will descend. As they thought it will descend, but the undescended testis dies at the age of 16 and atrophy will take place. It will be totally present in the scrotum, but it will not regenerate the spermatogenesis or it never produces spermatozoa. From only one testis, the spermatozoa has to be produced. So the undescended testis is a spermatozoa's defective function that has to be diagnosed if the child is brought to our clinics. So a physical examination of the child is must at the age of even 0 age, 2 years, 3 years, 4 years. So immediately surgery has to be done before the puberty. In the sense, puberty will start taking place even in males from the age of the endocrine glands will be ready. So by that time, the testis has to be matured and the pubertical changes and the maturity of the testis has to take place in normal temperature. The scrotum will provide the normal temperature to the testis. So the testis must descend before the age of 5 into the scrotum. Then only the undescended testis will be treated, whether it is surgically, if possible with homeopathic medicine. If they come at the earlier age, it is possible with homeopathic treatment because the ossification of the bones, the muscle development will take place even at the age of 5. So the testis will descend into the scrotum. Varicocele. In adults, varicocele is a big hydrocele. See the varicose veins of the testis and a varicocele. That will what happen when the spermatogenesis takes place. It is usually because of injuries, going on cycles, going on motorcycle, tight cut dryer. So are the making the scrotum to descend and are always standing without a cut dryer or without a support that will make the varicocele to develop or with infections. So there will be a varicocele. That varicocele will never supply to the blood flow from scrotum, and the testis will not be normal. To the again, the blood will not go to the venous blood, never reaches to the main internal vena cava. So the indescendant venous will be there, and that will kill the spermatogenesis and reduce the sperm count. Then are mumps and arthritis. Disease definitely causes the 90% of the mumps cases if they are inappropriately treated at the age of 3, 4, 5, 6, 7. Definitely there will be infertility, and the mumps complication is just making the scrotum totally dry, and the hyperinterstitial cells of the scrotum will die, and after attaining the puberty, the testosterone hormone will be normal, all the secondary sexual characters will come, but there will be the architis that will be present. It will not be known when we take the histopathological or the seminal vesicles and histopathological observation, or with a test is what is the interstitial cells are producing. When we take the seminal fluid, then only we will understand there will be complications of the mumps at the age of 5 or 6, which will not be understood up to the age of 30 in some of the cases. And in this case, where even allopathic doctor or a surgeon or a gynecologist or obstetrician or any homeopathic doctor can't help, because the interstitial cells of the testes have died. Then thyroid dysfunction. This thyroid dysfunction is becoming very common in young adults nowadays because of the obesity, because of the diet, because of the lifestyle modifications and living conditions. Nobody is bothered about their health. Nowadays, even Prime Minister is announcing that the obesity is one of the biggest problems. Kindly control it. That is because of lack of exercise and enough money to control. There is no guardianship and nobody is educating. So naturally, a male is undergoing their thyroid dysfunctions and obesity is coming. This thyroid dysfunction makes first erectile dysfunction, and by that the thyroid hormone will produce imbalances. So the testosterone will be very less. When the testosterone will be very less, there will be imperfect erectile function dysfunction will be present. By that the spermatozoa quantity also will be very less. Particularly, though the spermatozoa quantity is there, the seminal vesicles will be buried under the mucous membranes and the fat, and those seminal vesicles which will keep the spermatozoa alive and give smell to the sperms, so that it will be attracted by the internal os or vagina, and that will be killed, so that in thyroid dysfunction cases of male there will be infertility. The early diabetes is another cause. First is penile dysfunctions, erectile dysfunctions. Second is strength. The neuroimmunopathy, what happens? The peripheral nerves of the penis and testis will be disturbed. So there won't be any blood flow to the tip of the penis. So there won't be proper erectiles, and that also kills the testosterone and kills the spermatozoa, not testosterone. So diabetes is another reason, which particular the insulin dependent diabetes cases are increasing more. When the insulin dependent diabetes cases are coming, we have to study about this also. After the marriage, they will come with infertility, and immediately we have to doubt a male partner is having insulin dependent diabetes and he needs treatment. Then obstruction of efferent duct, that may be tuberculosis. The efferent ducts are the ducts that are coming from testes to seminal vesicles, and concoccal, that means there will be two ducts, and one duct will be closed and one duct will be open. Then during hernia, what happens if the hernia comes? When the hernia is removed, and they also will that will push, and it will make the duct to very near, and the duct walls will be closed. So a surgeon must be very intellectual, and a surgeon must be shrewd, and they also should take very good case history, and they have to keep in their mind that not surgically removing the hernia, which is inguinal hernia, or lymphatic conditions. When they are lymphatic tumors, they need not concentrate only on surgery. They also has to see the life and the care that they are giving to the patient on a holistic approach. And the life of the patient is most important, and the burden of the patient must be removed. Usually nowadays practitioners, though they study more and more about less and less, they are not cared about the patient's welfare. So that is another cause for male common causes of male infertility. Failure to deposit sperm high in vagina. One is impotency because of thyroid, because of diabetes, because of thyroid diabetes complications, because of varicocele, premature absence of ejaculation. What happens? The premature ejaculation will be there. In that, what happens? The seminal vesicles will secrete, and the spermatozoa won't be present. And the next time the spermatozoa presents, but the seminal vesicles never secrete seminal fluid. When the seminal fluid is not present, then the sperm will die automatically. So this is the abnormality of premature ejaculation, which will take place after the 40 because of the stress as well as diabetes and hypothyroidism. And hypospadiac. Hypospadiac means the ducts will be very small, and by the time it will reach, there will be premature ejaculation. The duct has to be made. This will be because of the physiological aspect part of the male, and there should not be any defect. If they come at an appropriate time, if they understand what is happening after the, see, usually what happens in male or female at the age of puberty, onanism. Onanism is one of the languages of homeopathic materia medica, and that is known as masturbation. So when they do that, they will understand. The boy will understand. Even girls will do. They will understand. So out of see, because of shyness, or they cannot tell their problem, so they never report to anybody. But these all are going to have retrospective effect in their mature life, where it will be taken as an uneducated. This is lack of awareness. Under the lack of awareness, unnecessary awareness is also coming. The necessary awareness is going out. That is the defect of the society. So this awareness has to be created. We have to take a classroom lectures to educate the male persons. It is not that male doesn't mean that they will have hyperactivity or something like that, but it is for bringing out kita and kin that are useful to the country. So that social responsibility must be there. Then error in seminal fluid, low fructose content. Usually what happens, seminal fluid, either low protein or low fructose. High PG, what is this, the content, in the sense that the protein and glucose content. Sometimes fructose glucose will be red, sometimes protein and glucose will be more. Undue viscosity. The viscosity of the fluid is most important. Unnecessary, the viscosity of the seminal fluid will increase. That is, the thickness of the seminal fluid will increase. That itself will kill the spermatozoa. These are some of the causes. And sperm count. The other cause is fresh sample of lab within 30 minutes. Most sperm in initial ejaculate. See how to content. The spermatozoa count has to be taken in the fresh sample within 30 minutes of the duration. The lab technician has to conduct the test. Otherwise, the most of the spermatozoa will come as dead. So male should be abstinent for 48 to 72 hours. The volume of ejaculation, the pH, alkaline 7 to 9, 2 to 6 ml is must. And see, in between 4 ml or 3 ml or something, then pH should be always alkaline, not more alkaline, but it should be in between 7, 9, 9. And liquefaction within 1.5 hours. See, half an hour the liquefaction. For that, the seminal ejaculation, the seminal vesicles will play an important role. And motility, at least 60% progressive forward. 30%, it doesn't mean that 30% should have less motility or more die. No, it is not like that. 60% should be very active, and they should be progressive. They should be carried out, and they have to complete, and 30% less motility. So normal shape, the morphology of the spermatozoa, this is also another important factor. The tail, the head should be sharp, and the tail should be very high, very lengthy, and the spermatozoa should be in a position to move as early as possible. Then only then this is morphology that will be done when the the morphology is normal. The technician or the specialist who is doing this microscopic examination, they have to observe for the morphology. These are some of the defects in sperm count are in male infertility. The sperm terms, see, zoospermia. When report comes, what is zoospermia? When we sit in our clinics, we will receive reduction in the vitality of the spermatozoa. What is this vitality in the spermatozoa? The strength of the spermatogenesis won't be takes place. The strength, they die immediately. So that is known as zoospermia. They will wait for time. See, if the semen is collected within 10 minutes, and by the time the lab technician take the sample and within 10 minutes it is dying, means the vitality of the spermatozoa is less. Teratozospermia, that means more than 30% of the spermatozoa with a normal morphology. Rest of all the 60% of the spermatozoa are without any normal morphology. So again, the 60% of the spermatozoa are not abnormal in morphology. That means the head is not in a position to penetrate and the tail is not long and they are not in a position to swim. So again, there will be infertility. Oozospermia, no spermatozoa present absolutely in the ejaculation. There will be only seminal vesicle will come. This will usually happens in interstitial cells defect. That is because of the complications of the mumps in earlier age. Nowadays, the incidence of the mumps reduced because of some of the vaccination. However, the mumps are yet coming and inoculation is most important. And oligospermia, the spermatozoa count is more than 20 million only. It should be more than 90 millions. And necrospermia, the spermatozoa are dead or motionless. This is another problem. These all will come under morphological examination of the spermatogenesis or spermatozoa. So we have to depend on the normal report. We have to give sometimes daily sample for 3 days in a different laboratories to test at a different time with good food and at a good atmosphere. Then only this will be properly calculated. And one physician should be very careful that infertility doesn't mean that it happens only with females. One has to keep in mind when the couple comes, both the couples must be addressed. First, female, usually the male dominated society will blame the female. So when the female, everything is normal, we have to go for infertility to treat infertility cases, the investigation on male partner. Then treatment goals. What are the treatment goals? To identify the cause of the infertility. Why infertility is coming? Number one, to provide basis for potentially successful treatment options. What treatment we can give? What is that is medicinally possible? What homeopathic treatment it is highly effective? What materia medica says? What the repertorization has given rubrics, and what rubrics are really validated and verified? What rubrics are written at table repertorization? See, the repertory of Boger, repertory of Kent, repertories, these old repertories are totally built up on the provings of the materia medica, and 99 medicines have been proved by Dr. Hahnemann himself in his materia medica cura. And in that purings, in those days, there were some defects. Nowadays, we cannot take provings ethically, scientifically on human beings. So we are also not taking up animal provings. So it is very difficult. It is scientifically, it is very difficult for homeopathic pharmacology to create an evidence-based science. And government nowadays, without testing animal provings, we cannot carry out on human provings. So again, it is becoming a difficult process. So we are living on our old literature. In that old literature also, the real literature that was present during Hahnemann time, after 100 years of Hahnemann time, is reality. Nowadays, the repertories are coming with any of the symptoms. Various repertories, we need not take the name. But the old textbooks like Helen's Keynotes, Kent Materia Medica, Farrington Materia Medica, Boger, and Boninghausen repertory, they are very genuine. And the repertory is written after certain time. The verification was not properly taken, and some of them are unscientifically, because it is in the print form. A new student or new homeopathic doctor in the society will believe them. And nowadays computerization came, so every symptom is added in the computer. That is again creating a lot of problems. So they believe the printed matter, they never understand, and they don't want to find out and accept some of the defects that are taking place in the homeopathy. And we have to keep in our goal of treatment the realistic prognosis, the offer of emotional support, and provide basic potentiality of the success treatment and options, because the case comes after failure from allopathic doctors. All the windows or the doors are closed, only homeopathic window is open. So that is credit goes to homeopathic doctors. When all the cases failed, all the cases from allopathic side failed, when one case is also successful, that brings good name to homeopathy as well as to homeopathy. So the first visit, have both to come and visit, get a complete history, then sexual history, see complete history. Here, this is the allopathic language. The case record is most important, and educate them first. Then, if that is failing, then you kindly teach them what is infertility. Well, you ask them to stop alcohol, ask them to stop drugs, ask them to wear loose pants, and previous testing investigations and latest investigations, and question them what needs anabolic steroids, cancer chemotherapy, whether they are using any. These all comes under homeopathic case record. A homeopathic doctor is the best doctor to investigate a case, better than an allopathic doctor or anybody in the world. And homeopathic case recording is highly standardized, as equivalent as to genetic medicine. So, women questions, infertility duration, detailed menstrual history, prior pregnancies, fertility in other relationships, and IUDs, OCPs, the anti-menstruated medicines, frequency of the sexually meeting together, what the partners are, what are dysfunctions, what is the psychological attitude, and gynecological history, pelvic infection disorders, endometriosis. We have a specific medicine for endometriosis. I will show you in my fifth part the mechanism of action of that medicine. And fibroids uterus, cervical dysplasias, fibroid uterus in a young child, and medical and surgical histories, medications, private tests and therapeutics, and drugs. Various allopathic drugs are antagonizing to antidepressant drugs, hypotensive drugs, gastrointestinal drugs, recreational drugs. They want to marijuana. See, they take, everybody take one. They want to enjoy. Spontaneous galacturia, ascertained and further investigations. Suspected case of hyperprolactinemia. See, there will be less lactose in the blood, that will create all spermatogenesis, and drugs they are used, they will make infertile a woman, particularly bhang and marijuana and all the drugs. So, and neuroseptic, antidepressant drugs, they all will have enormous effect over the fertility. The female infertility, it is a detailed table. You kindly see what are the
Excuse
cycles.
me.
My
Sorry
time
to
is
interrupt.
over. I have only 1 minute time.
Yeah, sure.
You kindly record this and you kindly go through this. The percentage of everything I cannot, you need not require any explanation. The artificial insemination is the last disorder, and IVF, in vitro fertilization, is another disorder. There will be gift, gamete infiltration transfer. These are the modern treatment which we have to know, because we have to apply homeopathic medicine. So this is a zygote in fallopian transfer, and there are ovarian stimulation, surrogate pregnancy. Farooq Khan, he delivered, he is having his second son with surrogate. Adoption. These are some of these environmental changes. So I end my lecture by this. If 1 minute or 2 minutes time is given, you can
Thank you,
ask.
sir.
The
Thank you.
next
And
time we are going for mechanism
yeah,
action of
we
medicines.
need to continue the everything in the next session. It was a wonderful session. It's a knowledge explosion also. It's a need of the hour. You explained a lot of things regarding the physiological, pathological aspects behind these things, and we are waiting for the next session, because on that we will get that therapeutic part also.
Thank you very much, sir.
You are a well knowledgeable person. Thank you. Thanks a lot. On behalf
Ram
of you.
Parvesh, Shah Sahab, Namaskar. Just let me wish everybody, thank you very much. Namaskar, sir. Namaskar.
Thank you. Thank you, doctors. On behalf of IFPH, I thank you all. And I thank Dr. Prakash Rao for this excellent session. And we are running out of time, and I am passing the session to Dr. Shaila for the Malayalam session. Thank you.
Thank you very much, sir. Thank you very much. Can I take leave, sir? Thank you, Ram
Yes,
Parvat.
yes. Thank you.
Sir, Shah Sahab, namaskar. Thank you very much.